Good afternoon, this is Nurse Molly reporting for patient Rashid Haim. He is full code status and also a watcher. He is a male in his 50s with no known allergies, who is admitted with dehydration and hypokalemia this morning from episodes of severe diarrhea, vomiting, nausea, and abdominal cramping. These episodes started about 3 days ago after patient returned home from international travel. On admission, he was still reporting feeling dizzy, weak, a fever, and continuated nausea. Currently, his fluids and electrolytes are being monitored, and he was treated on admission with ondansetron for nausea. He is also being treated with 1,000 milliliters of 0.9% sodium chloride with 20 milliequivalents of potassium chloride at 150 milliliters per hour continuously. On assessment, the patient reported pain from stomach cramps and a headache at a level 4 out of 10, but insisted not to receive any medication for the pain. His pulse is currently high and tachycardic at 122 beats per minute and at an irregular rhythm, but with normal heart sounds on auscultation. There is also a sign of tenting within the skin. The skin was also dry and has a 4-second capillary refill. The patient also had a potassium lab that was low at 2.9 milliequivalents on admission, but is improving, but still is low at 3.1 milliequivalents. Another lab that was high on admission was his BUN lab, but is trending downward, but is still reported to be high. The patient has also stopped vomiting and diarrhea episodes, but still has very little intake and output. The output was only reported to be 235 milliliters this shift. He is also stating that he's scared to intake much due to the risk of nausea, vomiting, or diarrhea. He is still reporting that he is very fatigued and weak. His abnormal vitals were taken with a temp of 101.4 degrees Fahrenheit and a blood pressure of 100/72. His weight on admission was 162, which patients state is 10 pounds less than normal. He is also still irritable with signs of grimacing and short conversation. The patient is also still labeled as a fall risk, as we are waiting on stool culture. So within the next 4 hours and every 4 hours after that, monitor vital signs and chart them. And within the next 2 hours, the provider just ordered that the patient must have another basic metabolic panel completed. And also continue to offer the patient clear liquids, which is the diet he is on, and monitor intake and output, while educating the patient on his intake of clear liquids can help with dehydration and hypokalemia. Also continue to monitor the IV site for infection, infiltration, or phlebitis, and also monitor the bag of fluids to see if they need to be switched out. Also watch for signs of severe hypokalemia that could send the patient into cardiac arrest. And notify a provider right away if vitals worsen or patient starts to decline or complain of any chest pain. Apply precautions if the stool culture comes back with positive results. For now, stick with standard precautions, and if you see anything before the culture comes back, apply precautions with notifying the provider. Also, apply seizure precautions due to his low vitals and dehydration and hypokalemia, and also notify the provider if anything like the vitals on the patient continue to worsen. Do you have any questions for me? Okay, perfect. Have a good shift.